Hello and welcome. I'm Andreja Šajnić, ERS Nurses Group Chair and member of Croatian Association for Patients with Lung Cancer, Jedra. And today I will speak on behalf of Sandra Karabatić, President of Croatian Association. In 2020, pandemic changed how hospitals provide care to both acute and chronic patients. Healthcare systems around the globe are affected by pandemic, interrupting the medical care for oncological patients. Early detection and successful recovery are already heavily impacted. By September 2020, the number of new diagnosed patients dropped by 40% worldwide, and this number is increasing. New normal reduced the number of prevention examination. Diagnosed patients do not have follow-up examination or treatments either because they are afraid of COVID-19 or their schedule is postponed due to hospital overload caused by pandemic regime. Every third European country partially or completely stopped medical care for oncological patients during pandemic. So we have now new normal, but same cancer, and cancer keeps no distance. If we look this from a different perspective, COVID-19 has become privileged class disease, and unfortunately all other conditions and diseases are put a little bit outside when we talk about early diagnostic and timely manner treatment. Now, I would like to talk about our experience and challenges we crossed on our path. In 2020, on 22nd of March, during the first wave and outbreak of COVID-19, earthquake occurred in our main town in Croatia, Zagreb. Consequences of the earthquake resulted in static damage to the large proportion of the buildings. Many hospitals and clinics were damaged, and one of them was our Department of Respiratory Diseases. It was a big shock for all of us, and something that we never expected that is possible to happen. Media broadcast warnings, and we were all in fear of possible next earthquakes. Nurses in our department undertook everything that was needed to calm patients with their smiles and maintaining good mood. This is how evacuation of our patients looked like. Same day, stable patients were discharged, and unstable patients who needed clinical health care were immediately evacuated to the main building of University Hospital Center Zagreb. And this is how our wards look like after evacuation of all of our patients. I would like to mention that it is not good policy to assume anything in your life. When we are faced with a situation like this, only then you realize that this is one of the things you never think about because you believe it will not happen to you. Our oncological outpatient unit was also damaged during the earthquake, and our patients were left without the possibility of receiving the therapy. The largest part of the treatment and management of oncological patients from a large part of Croatia is delivered through our outpatient unit, and only in one day it was all gone. Our patients were desperate and in fear. They had only one question: how will they receive their treatment for cancer? All Croatian media broadcast the information that oncological patients cannot receive their treatment because there was no functional spaces in that time, and at that moment huge public pressure has arisen. Facing this situation, we realized we need to act fast and efficiently. We provided and followed up development plans for starting the outpatient unit in available facilities with our hospital center. In only 1 week, we organized and started to work in available spaces. What were the issues? Well, by losing a large part of available beds, consequently all patients were direct to outpatient unit. So in that point, we were also obligated to organize delivery of therapy for them too. Nurses were reorganizing categories for applications of chemo and immunotherapy, target Therapy diagnostic appointments corresponded by email and telephone call. The first action was that all nurses start calling and informing each patient about new scheduled appointments for therapy, diagnostic, and additional measures related to COVID-19. For better communication, we collected from each patient or caregiver their email address, and all consultation regarding new appointments, management of side effects, schedules for diagnostic and treatments were corresponded by email by one educated oncological nurse. If there was a need regarding more complex issues, nurses for correspondence first consulted with oncological specialists. In 6-week evacuation period, the outpatient unit had 1,843 appointments, and the largest part was carried out in the first 2 weeks, and here you can see our data. Each patient was given an exact scheduled time of arrival. All measures were conducted to limit unnecessary exposure of oncological patients to the potential risk of infection. After 6 weeks of evacuation, we returned our unit to the Department for Respiratory Diseases. Forced to COVID-19 outbreak and earthquake, new way of organizing resulted in better communication and management. So, as I previously have mentioned, 40% less new diagnosed patients mentioned earlier does not reflect cancer incidence, but is rather call for action. Health campaigns directed to oncology patients, public and health stakeholders are more important than ever. In 2009, Sandra established a nonprofit organization for supporting patients with lung cancer. From the beginning, she organized numerous public and health campaigns with the goal of raising public awareness and changing health policy in the treatment and management of the lung cancer patients. And during all of these years of public health lobbying, we are proud that we always had support and active participation from our patients, nurses, physicians, physiotherapists, psychologists, and media. In 2020, our association, in collaboration with Croatian Umbrella Association for Oncological Patients, organized public health campaigns talking about lung cancer, and we also launched educational campaign, I Breathe For You. Goal of this campaign was raising public awareness and changing health policy in the treatment and management of lung cancer. Campaign objectives were raising the importance of lung cancer among public, education on symptoms and risk factors, and importance of timely diagnosis. First step was organizing media release. For that reason, we organized press conference with art exhibition, body painting, with key messages about lung cancer, and we also had presence of other policy stakeholders. Before pandemic, we started with live and later continued with video breathing workshops for patients, students, healthcare professionals, and journalists. During workshops, respiratory physiotherapists presented the relaxation and breathing techniques. Many Croatian celebrities such as athletes, Olympians, opera singers, and musicians join us in our educational campaign. They recorded video messages where they talk about the importance of proper breathing in achieving top results. Inspiring and amazing support was from the music band, in which all members are deaf or have hearing impairment. They stated when they play their musical instruments that they feel the proper performance of their tone through vibrations in their body, but also emphasize the importance of proper breathing techniques when they play their musical instrument. Our campaign was also supported by healthcare professionals with short video messages. They talk about innovations in treatment of lung cancer, chemotherapy, immuno and target therapy, and management the side effects of these treatments. Our Sandra, on behalf of Croatian Association for Lung Cancer, was involved as board member in the project Heroic. Objectives of this project were empowerment of mental health, rehabilitation, and reintegration of oncological patients during pandemic. To conclude, 2020 was extremely challenging in many ways. At the same time, we demonstrated ability to cope with many difficulties. On behalf of our team, I would like to thank you for giving us the opportunity to tell you what happened in 2020 in Croatia during outbreak of pandemic COVID-19 and earthquake. Thank you. Bye.